Hey guys, what's up? Dr. Jenna here. I wanted to hop on today and talk to you a little bit about one of the most common statements that I hear from potential clients, and also one of my biggest pet peeves and myths around getting help for your hip pain. And that is, I'm waiting for my MRI results to get started. I hear this statement all the time on a weekly basis. People say, I really would like to do a discovery call or my evaluation or get started with one of these programs, but I have an MRI coming up in the next 2 weeks and I want to make sure that I get those results before we get started. So I want to talk a little bit about why that maybe isn't the best strategy and what you could maybe do instead of just sitting around waiting. The reality is, choosing to wait to get your MRI results is a decision that is very likely what is keeping you stuck in pain for a long period of time. And you don't have to be stuck in that pain, because very often there is something that we can do with you. As a physical therapist, there's a lot of things that we can start before we actually know what an image says. An MRI itself it can be really important and a valid tool for diagnosing and figuring out what's going on in your hips. However, it is really important to understand that that is only one tiny little piece of the puzzle. It is not the whole story. Very often when we get that MRI and we get a label slapped on it, so I've got a hip impingement, I have a labral tear, I have arthritis, our brain naturally goes to, well, I'm going to just be in pain. I'm destined to be in pain. It's a structural problem. It's arthritis. It's never going to go away. The only thing that's going to make it better is surgery. And it's not that you're doing anything wrong. It's just that we've been fed this narrative for so long that structural problems can't be fixed. And while that is true, yes, structure is structure, there's a whole lot that you can do to actually still relieve pain that we can work around structure with. And that's not necessarily something that an orthopedic surgeon is going to understand or be able to explain to you, because that's just not what their job is. Their job is, there's a structural problem, I can surgically go in and fix it. A physical therapist is trained to be able to work with your movement and how you move and be able to adapt your movement so that it doesn't continue to cause you problems and pain. So the problem with the MRI being the only diagnostic tool that you use is it only shows the structure. It doesn't take into account how you move, how your body transfers or accepts load or weight. It doesn't look at what's your nervous system doing. Is there a lot of muscle tension or imbalance present? Is there weakness or instability present? It doesn't look at any of that. It just looks at structure and determines, is there a problem there or not? And the other thing that's really important to understand from that is that just because there is a structural finding, that may not be the source of your pain. Sometimes it is, but not always. And they do this all the time, where they will take, they'll do research studies where they take MRIs or even x-rays of lots of hips. And they look in people who have zero symptoms. So no pain, no range of motion restriction, nothing. And 60 to 70% of those MRIs come back with a significant clinical finding on it, meaning maybe there's labral tears, maybe there's impingement, arthritis, like all these different types of things. But these people don't have any symptoms. So what we know from that and what we can learn from that is that just because there's a structural change or a labral tear or a problem, that doesn't automatically mean that is where your pain is coming from. Your pain could be coming from compensation movements. You might be getting an overuse injury or a tendonitis because you're having to kind of compensate and move differently. It can just be something completely different. And the structure itself is not what's going to dictate if you're going to progress or not. So it's really important to understand that piece before you jump into having an MRI. I also always tell my clients to just understand that there's a really good chance, there's a really good probability that your MRI will find something, but it does not mean that what we are going to do here in physical therapy or with movement isn't going to change it. So just always kind of prefacing that and making sure that people understand that, like, your MRI isn't your story. It's not your whole story. So I think that's a really important thing to understand. The other thing too is that from a physical therapist standpoint, waiting to start the MRI really doesn't make a whole lot of sense, because there's a lot that we can do in the meantime. And when you think about what happens when you have a hip injury or you're having pain, most of the time you put it off for a little while and then you finally decide you're going to do something about it because it's not going away. So you go in and you make an appointment with an orthopedic doctor, and maybe you can get right in. Maybe it takes a couple weeks. Probably it takes a couple weeks. And then you have that appointment and the doctor says, I'm not really sure. They do a few tests. I want to get an MRI just to rule anything out, make sure everything's good. So now you got to wait a few more weeks. Maybe they can get you right in, maybe not, to have the imaging done. And then you got to wait for the next appointment, which could be however long, to meet back with the orthopedic doctor to get the results, for them to very likely say, you either need surgery, you need an injection, or you need to go to physical therapy. And now it's a waiting game for that next step. You have now just wasted potentially 8 weeks, who knows how long, waiting for appointments, waiting for an image, waiting for a result that maybe isn't even going to be the answer anyways. And people get really upset too. I have so many people that come in and they're so upset when they're like, my MRI didn't find anything. Well, you could have come in for physical therapy first, and we could have gotten started on some of this stuff so that instead of waiting 8 weeks to start getting better, you actually started changing your movement and getting the pain relief in the beginning when you started feeling that pain. And now all that time hasn't passed, because in that time frame, not only are you frustrated by the pain that's happening and how uncomfortable you're feeling, but now you're very likely also getting some other movement compensations that are starting. You've had to stop working out at the gym, or you've had to stop doing the activity or the running or whatever it is that you love. And that emotionally is hard, and physically hard on your body, right? When in all actuality, you are absolutely able to go in to see a physical therapist or a trained professional, especially somebody who deals with hips all the time, that can assess and see what's happening from the outside and determine, do we even really need an MRI to treat this in the beginning, to begin with? Or what's the plan here? What can we get started on? And maybe you already have that MRI scheduled, but now we can start giving you pain relief early on. And that may come in the form, it's different for everybody, but it may come in the form of manual exercise or manual therapy, massage and dry needling and things like that. It might come in the form of nervous system retraining, breathing, relaxation techniques. It might be stretching or mobility. It might be strengthening or stabilization. It's going to differ depending on what your presentation is and what your symptoms are. But there's always something that we can start with. And then in the meantime, if we see any red flags or we see things that aren't improving, then absolutely we are still going to refer for that MRI. But more often than not, there is always something safe to at least start with. And if you're not, the physical therapist especially will guide you through this. If you're not sure about jumping into a full-blown treatment, you can at least get the evaluation done to figure out, do I need the image for this or not? I will tell you 90% of the time, probably higher than that, 99% of the time, I'd even say, my clients don't actually need the image. What I generally direct them to is, let's do the evaluation. If I don't find any red flags, if I can alter your pain just based on movement and what's happening, or if we do some manual therapy and it starts to feel better, then I've got a really good idea of what is going to get you out of pain right from the beginning. Let's do that. Let's go through this process for the first 4, maybe 6 weeks. And if at that point we are seeing zero change, then absolutely I am referring you back to the doctor. If we need to get an image, whatever we're going to do. But more often than not, you're going to start seeing improvements in 4 weeks. There certainly have been cases where I haven't seen people have improvements and then back to the doctor they go, but that has been so few and far between. The majority of people are going to start feeling better, and many opt to never even have the image done. And I think that that's really powerful because it shows you that you are a bit more in control of your pain than you realize. Your MRI is not your destiny. Just because there's a structural finding, or maybe there isn't a structural finding, you are not destined to be in pain forever. It's really important to just find somebody who understands the situation that you are in, a hip specialist, somebody who sees this all the time, so that you are able to safely get started on a plan and a strategy that's going to work for you, whether or not you have that MRI in your hands on day one. So I hope that that was helpful for you guys. If you ever have any questions, comments, concerns, whatever, drop them in the comments below. Let's have a discussion about this. But if you are somebody that's been on the fence and you've been waiting around to start saying, I'm just going to wait till I get my MRI results, I hope that I've at least gently persuaded you in the direction of maybe not waiting, and that you can actually start getting pain relief a whole lot sooner than you realize. So hope that was helpful, and I will see you guys again really soon. Have a good day.